Hello, welcome to Opioid Education and Naloxone Training. First, let me introduce myself. My name is Taylor Bybee. I am a health education specialist at South Central Public Health District, and my primary focus is on drug overdose prevention, especially towards opioids. So basically, this slide just states that I am funded by the CDC so that I can do these presentations. However, the CDC gives me complete freedom on what I present, and so these presentations do not necessarily represent the official views of the CDC. What are prescription opioids? Prescription opioids are prescribed by a doctor to treat pain. Prescription opioids are used to treat moderate to severe pain, as well as short-term or long-term pain. However, prescription opioids have some risks. Prescription opioids can cause addiction. It is possible to become addicted to prescription opioids in as little as a week. Prescription opioids can also lead to overdose or death. You may think, well, just be responsible and follow directions and an overdose won't happen. However, it isn't always that simple. Let's say grandma broke her hip and was prescribed codeine to help with the pain. One morning, grandma wakes up and takes her prescriptions, including her opioid. Then grandma has some breakfast and watches some TV. After an hour, grandma still feels pain in her hip. Grandma decides she must have forgotten to take her pain pill, and takes another. Now this could be dangerous, and grandma has a higher possibility of overdosing. Opioids can also lead to pregnancy complications, especially towards the baby. Sometimes using opioids while pregnant can lead to miscarriage. Also, the babies may experience withdrawal symptoms when they are born, and experience side effects such as crying a lot, inability to sleep, throwing up, and uncontrollable shaking. Opioids also have side effects such as sedation, which is sleepiness, constipation, and respiratory depression, which is a fancy word for slowing down of breathing. The reason an overdose can be deadly is because the opioid may slow down breathing or stop breathing altogether. The chart on the right is a prescription opioid list. It could be useful to be familiar with this chart, as sometimes not even doctors know different types of opioids. One of my friends had an ear infection. She went to the doctor because the only way to treat an ear infection is with antibiotics. The doctor wrote her two prescriptions. One was an antibiotic, and the other was tramadol, which is on the bottom of this chart. My friend knew tramadol was an opioid, and said she did not want an opioid. The doctor did not believe he prescribed an opioid. My friend got the doctor to look it up on his phone to find that tramadol is an opioid. So it can be helpful to have this chart handy. Please feel free to take a screenshot of this chart or take a picture of the chart so you can reference it later. There are also illegal opioids. Illegal opioids include heroin and illicitly manufactured fentanyl. To give you an idea on how strong these opioids are, heroin is about 2 to 5 times stronger than morphine, and fentanyl is about 50 to 100 times stronger than morphine, depending on how each are made. Sometimes fentanyl is mixed with heroin to make it stronger without the knowledge of the user. It's also important to note that methamphetamine is not an opioid. It's actually a stimulant, similar to cocaine. As you can see, illegal opioids have the same risks as prescription opioids. This shows how similar they are. However, the risks are higher with illegal opioids because illegal opioids don't come with directions like prescription opioids. People who use illegal opioids use the amount they think they should use, which could be fatal. There are multiple risk factors that increase the odds of an opioid overdose. The first is if opioids are taken with alcohol, other opioids, or sedatives, such as Valium or Xanax, which is why it's always important to tell your doctor any prescriptions that you are using. It's also why it's important to stay with the same pharmacy. For example, let's say that you're taking Valium, and your doctor prescribes you an opioid, and you forget to tell your doctor that you're taking Valium. Well, then when the doctor sends the prescription to your pharmacy, the pharmacist will see, oh, this person is taking Valium, and this opioid will cause dangerous effects. And so then the pharmacy will cancel that prescription. The chance of an opioid overdose also increase when opioids are taken in larger amounts or more often than prescribed, which is why it's always important to follow the doctor's directions when given a prescription. Also, the chance of an opioid overdose increase when opioids are taken at previous doses after a long break. So let's say this one person is taking morphine and is taking 50 milligrams of morphine twice a day. And then this person goes to jail for 6 months. Well, because that person developed a tolerance, they were using 2 doses of morphine. But while being in prison, then that tolerance may go down. And then when they get released from the prison and start trying to use that exact same dosage, then they could overdose. The chances of an opioid overdose also increases when rotating from one opioid medication to another. Which is why if you do need to rotate opioid medications, to talk to your doctor and to follow the doctor's directions. Chances also increase when other medical diseases are present, such as lung disease, sleep apnea, or kidney or liver problems. The chances of an overdose also increase when there is a history of substance misuse or non-medical opioid use, as they're just more susceptible. Also, the chances of an overdose increase when starting long-acting opioids as initial opioid treatment. Because, for example, let's say someone gets a tooth pulled and is in a lot of pain. Well, for that tooth pulled, the person probably would only need maybe 3 days, maybe 7 to help with that pain. And there'd be no reason to give this person a month's worth. As for one, there's more susceptible to becoming addicted, and there's also just more pills to be able to overdose on. It's important to be able to recognize an opioid overdose, because if you can recognize an opioid overdose, you may be able to respond quickly enough to save somebody's life. So the first sign is small or pinpoint pupils, which basically means the pupils in your eyes just get so small that you can't even see them, and they look very unnatural. As well as falling asleep or loss of consciousness, slow, shallow breathing. As we mentioned before, respiratory depression is a side effect of opioids. Choking sounds or snore-like gurgling sounds, as that is also a sign of struggling to breathe. As well as a limp body, pale blue or cold skin, especially around the lips, as that's usually one of the first to change color. And also needles or empty pill balls around the person, as that is a sign that an opioid was used. And call 911 immediately if an opioid overdose is suspected. Basically, whenever someone survives an opioid overdose, it's because somebody was around that was able to respond quickly. So what is naloxone? Naloxone is medicine that can temporarily reverse an opioid overdose by restoring breathing. And there are 3 forms available. One is a nasal spray called Narcan, which is pretty simple. You just stick it up the nose and squirt. An auto-injector called Evzio, which is kind of similar to an EpiPen. How you don't see Evzio too often just because it's really expensive. It costs around $3,000. Or injection by a needle and syringe. Kind of like with insulin. However, you don't see this form either too often just because you need training to be able to use it. So usually just hospitals or first responders use this form. And it's important to note that it only works on opioid overdoses, such as prescription opioids, heroin, and illegally manufactured fentanyl. It will not work on a methamphetamine overdose. It will not work on a cocaine overdose. It's important to note that the effects typically last about 30 to 60 minutes. And so it's important to still be able to call 911 if someone has an opioid overdose, even if you have naloxone, because basically naloxone just gives the person that overdosed more time and it gives first responders more time to get there. So who should carry naloxone? One is anyone prescribed opioids who also has risk factors for overdose that we mentioned before, as well as anyone who uses illicit opioids who may be around someone who uses illicit opioids, as naloxone does not have to be intended for your own use. As if you do have an opioid overdose, it will be very unlikely that you'll be aware enough to be able to administer naloxone yourself. Also, anyone who may have a reason to encounter someone experiencing an opioid overdose. This can be a plethora of people, such as police officers, firemen, EMS, schools, libraries, homeless shelters, the list can go on. So where can you get naloxone? One is through prescription from a medical professional, such as a physician, a physician's assistant, and a nurse practitioner. However, you don't even need a prescription for naloxone. You can literally go up to a pharmacy and ask for naloxone, and they can sell it to you. There's even some places where naloxone is available over the counter. However, as far as I know, there isn't any pharmacies in Idaho that does that. And it's important to note that naloxone does not need to be intended for your own use. And so if you want naloxone in case someone else has an opioid overdose, you can also go up to a pharmacy and ask for it, and they can sell it to you for that reason as well. So there are also ways to get free naloxone. For individuals, you can contact the Idaho Harm Reduction Project. You can text or call that phone number or visit their website and basically tell them what's going on, and they may provide you naloxone. For organizations, you can contact Narcan community programs as they provide kits to YMCAs, public libraries, and public schools. And you can visit that website to get more information. Also, the Idaho Office of Drug Policy has a naloxone mini-grant programs, and it provides kits to law enforcement, emergency departments, treatment centers, recovery centers, crisis centers, homeless shelters, and other qualifying agencies. And to get more information, you can visit that website. It's important to store naloxone correctly, as it'll be more effective in case of a situation where you might need it. One way to correctly store naloxone is to keep it in room temperature. So don't put it in your fridge, in your car, outside, just put it like in a shelf in your house. Also, it's important to keep naloxone out of sunlight, as it may not be as effective if it is kept in sunlight. Also, keep naloxone out of reach of children, which frankly should be in with any medicine or prescription. Also, let others know where it is stored in case of an emergency, because if only one person knows and that one person is gone, then the naloxone won't be effective. Also, know the expiration date and replace as needed. Naloxone usually has a shelf life of about 18 months to 2 years. And so one great way to remind yourself is to put it on a calendar. So you may have heard of the Idaho Good Samaritan law if you ever gotten CPR certified. So basically it states that if you do CPR certification, then you will not have any legal repercussions against you. And so there's also Idaho Good Samaritan law regarding opioid overdoses. And so the first part is any person may administer naloxone. You don't need any specific training for it, especially for Narcan, the nasal spray. But they still should contact emergency medical services as soon as possible. Also, any person who administers naloxone shall not be liable in a civil or administrative action or subject to criminal prosecution. So basically, if you have a legitimate reason to believe someone has an opioid overdose and you administer naloxone, you will not get sued. You can't get any legal persecution against you. And basically, if you administer naloxone to somebody that doesn't need it, basically they'll just be a little uncomfortable for an hour or so. Also, certain people acting in good faith, seeking or needing medical assistance for drug-related overdose shall not be charged or prosecuted for possession or use of controlled substances. So basically, if someone overdoses, they can seek medical help, they can call 911 to get help, and they will not get arrested. So this slide is a visual representation on how to respond to an opioid overdose. However, because of how I'm recording this, it will not let me show the video. So the video is on a link in the description, and I would really recommend you watching it. There are multiple resources available for those struggling with opioid addiction. One resource are doctors trained in medication-assisted treatment, otherwise known as MAT. MAT makes it easier for one struggling with opioid addiction to overcome the addiction and not experience severe withdrawal symptoms. There are also 24-hour crisis centers available in multiple locations in Idaho, including Twin Falls. There are also multiple recovery and support centers available as well. To receive more information, you can visit stopoverdoseidaho.org or call the Idaho Care Line at 211, or you can contact me as well. If you have any questions, then please feel free to contact me at my email, or you can call me at the number below. Also, if you watch this video, then please fill out the survey in the description, as that helps me know what you learned and how I can improve. These are the references that I used for this presentation. Feel free to use them if you want to discover more information. Thank you for joining me on this presentation, and I hope you have a good rest of your day.